Hi, everyone. This is Pam Reese with Adventures in Aging, and I'm here today with Gary Vandenberg.
It's great to be back, Pam.
Yeah, and the good news is we had several viewers on our last podcast.
Wonderful.
And I just want to give out a big thank you to everyone that listened, to everyone that commented. It means so much to us. So if you could please keep that coming, keep listening, share and review, we certainly appreciate it.
It's Adventures in Aging, living dangerous, right, as we get older.
Every day of our lives. So, Gary, it is the 1-year anniversary of the pandemic.
Sure is. Tough.
And there have been, as of today, just statistically, 544,000 deaths and 30 million people were affected.
Unbelievable.
And from that 544,000 deaths, 40% of those happened in our nursing homes.
It's unbelievable. That's almost half when you think about it.
No, it really is. So I did some math, and 216,000 of our elderly died from COVID. And just to give some other statistics, just so our viewers are aware of that industry, the nursing home industry and the elderly. And if we remember in the beginning, a year ago, a lot of talk about the vulnerable.
Right.
Saving the vulnerable, our most vulnerable. And that was our nursing home residents and our elderly residents. So there are 15,500 nursing homes in the United States, about 900,000 assisted livings.
A lot.
It is. And they house or have staying in those communities a collaborative 2.35 million.
Wow. And how many of those do you think are, potentially vulnerable to these types of conditions or illnesses? Would you say it's like 70% or 80%? What do you think it is?
I think it's probably around 85.
Unbelievable.
Unbelievable. So you have 85% of that 2.35 that were very vulnerable, but not to mention anyone living in congregate situations are at risk anyway.
Right. Wow.
So in the United States today, there's also about 40 million people that are over 65 years old. And so just think of the math. There's over 37 million that aren't living in communal.
Yeah, usually the number's like close to 95%. And that's something you and I have talked about earlier, is that typically in nursing homes, if you're over 65, it's usually like 4 to 5% of people, and assisted living is like 1%. So when you stop and think about it, 95% of people over 65 are out in our communities. They're in family settings. They're in different locations.
Right. And that population was impacted as well.
Absolutely.
Right? Not to mention us all, but when we think of our most vulnerable. So about a year ago, as we remember, among the first cases, I think it was around February 28th, we heard of the first resident of a nursing facility in Kirkland, Washington.
Right, I remember that.
Who tested positive for COVID, ended up, the nursing home had a massive breakout. They had 81 COVID positive residents, 34 staff were COVID positive, and they unfortunately ended with 23 deaths. And when that news broke, unfortunately, that gave even a more negative stigma to the nursing home industry.
Yeah, sure did.
And so over this last year, just working with the elderly, I have seen the huge impacts of this and how that has affected them. But it's affected all of us.
Absolutely. I know that, when it broke out, I was working in an assisted living company, and I continued to be there all the way up until October, and then I fell victim. I was the guy that was part of a mass layoff because it had impacted the company so much. So, but every day going in with the staff, and we had to get our temperature going in and answer those questions. And if we even went out to the parking lot and back, we had to get a temperature again and sign in. And it was just so difficult, and how the impact slowly started to really impact the families and the isolation of the residents, and just the concerns that were coming up constantly was really something I think it'll be a long time for us to get back to that new normal, if there is one.
So as it brought some families together, as college kids were coming home, moms and dads were starting to go live with their kids.
Yeah, they were taking them out.
They were taking them out. Right. And then we had the population that had no one. Right?
Yes.
Or the population of families that were separated by states or by miles.
Yeah, distances.
Right. And so in some instances, it brought people together, and in many instances, it tore a lot of people apart.
Right. Even though you could technically get on the phone and see your loved one every day, it was not the same as being there in person. And even going to the windows and trying to talk through these crazy situations like that, it was really... the families were constantly concerned, what's going on in there? Is mom being okay? Is she okay? Why is she being isolated? Those types of things. You and I had talked a little bit about a situation I ran into where a family member had wanted to meet with me, talk about his mother. And, he came up with that phrase, well, she was, older people are going to die anyways.
Yes.
And I said, at first I was kind of put back and shocked, and I wonder if a lot of people think that, when you think about the nursing homes. And I said, but they, and I said, I see their obituaries on the walls. There's a tribute to the people that have passed away. They didn't expect to die now.
No,
you know what
I
I'm saying?
So agree. And there was those statements being said.
Oh my gosh, yes. And so, and how I think we were trying to make up the rules as we were going along. There's a little bit of confusion there about mixed messages with what the state was saying, what the CDC was saying, what the government was saying, wasn't there?
Yeah, and just to recap some of that, and for our viewers that had loved ones in nursing facilities or in assisted livings or memory cares, these facilities are governed by CMS and by the state health departments.
Right. Outside of nuclear plants, I think nursing home industry has always been one of the highest regulated things there is.
There's over 200 and some regulations that they have to follow. Plus, they have to have licensure regulations by the state.
Sure.
And just to give a little information, that their biggest funder is CMS, right? Medicare and Medicaid.
Right. Absolutely.
And so not only is CMS their funder, but they are their controller as well. And so on any good day prior to the pandemic, it's a daunting effort to stay within compliance of all those regulations. And in fact, the facility's policy and procedures are based off of compliance.
It sure is.
So with COVID, the nursing homes were as ill prepared as anyone, right?
I think we were all in that same boat. Society was.
Society was ill prepared. The hospital systems were ill prepared. And if you remember, after the news broke about the nursing home in Washington and how horrible and how vulnerable and we had to protect them, a lot of the efforts were then placed to the hospital systems.
Oh, absolutely. Yes.
Trying to ensure enough ventilators, making sure we had enough staff.
PPEs, all that.
All that. The supplies. N95 mask, if you remember, it was horrible to even find N95s.
Sure. I think some of the closures in these states were related directly to the hospital ability to handle numbers of people. I remember originally it was going to be like 2 million people were going to die or something.
Oh, yeah.
It was terrifying.
And then all we ever saw was flattening the curve.
Yeah, flattening the curve.
Flattening the curve, which means slow it down. It's going to happen, but slow down the virus so that the hospital systems
could handle it.
Right. And so we saw countless support for the hospital systems, and as we should, right? I'm not saying that should not have happened, but so much emphasis put on money for the ventilators, money for extra staff, hiring extra staff. I knew nurses at that time that were receiving up to $8,000, $9,000, $10,000 a week to function as supplemental nurses in high-risk areas such as New York City. And so there was no holds bar in trying to step up to control the virus and to treat the virus. But the nursing homes, there was a lot of talk about them, but nobody flocked to the nursing homes.
Yeah.
You know, unfortunately, there weren't makeshift nursing home tents put up in their parking lots. There weren't extra staff showing up to help them, and they were kind of left on their own.
Yeah. And just again to our listeners, I've been involved in nursing homes for 40 years, and
Right.
Pam, you've been involved for how many years now?
The same, right?
So we're very much aware of the inner workings of these places and what's going on there, and how there's so much when it comes to it. There's a perception, and believe it or not, I remember doing a study one time, and I was asking visitors before they moved in what their opinion of was nursing homes, and it was like 85% had an extremely negative opinion of perception.
Sure.
But then later, when I asked, during resident surveys or discharge surveys when somebody was going home, how was their experience? It was completely flip-flop. It was 85% were very positive. And so you end up with the community in large having a negative perception at times until they experience it, and then it becomes positive. And there's always that stigma. I've had to fight it every day of my life, I think, of trying to say there are good things that happen in these places. The staff do care. They actually are family to many of those residents that didn't have family or have access to being there during this whole situation.
No, that's an interesting point, that once a resident enters the nursing facility, they do realize that it wasn't as bad as they had always heard it to be.
The value of having somebody there 24 hours a day.
That's right.
Type of situation.
So, but what happened negatively was all that perception in the communities prior to COVID really escalated after COVID. Mm-hmm. And as of today, we have nursing home companies that are getting ready to close down their facilities because they can't bring up their census, because they have spent tons of money on their supplies and on staffing and meeting the needs of the residents, and also all the infection control procedures that they had to implement.
Yeah. That was one question I was going to ask you, Pam, is being a nurse that you are, I'm not a nurse, but is this something that you think would impact people coming into wanting to be a nurse or being a nursing assistant or someone that's working in these type of senior living situations?
Gary, I almost feel like it would not. I almost feel as if people might say, you know what, I want nothing to do with being a nurse or a doctor or a caregiver. Yeah,
and, you stop and think about the pictures of those overstressed, workers in New York City, and they're all in gowns and they're masked up and they look like they've worked 20 days straight.
They feel like they did, and I'll tell you what, many of them did. Many of them did work day after day, 16-hour days, and not only do you have the physical exhaustion, but you're wearing full PPE, the N95, the face shield, the gown. You're breathing in. I don't know if it's true. I'm sure some scientists would tell me, or some manufacturer. But wearing an N95 mask, you feel like you're breathing in those fibers.
Oh, yeah. Well, I feel like I can't breathe at all. I've worn those a lot over the last year, and I'm gasping for air sometimes.
No, right? You get a little more short of breath. And your mouth gets dry. You're ending up with a scratchy, sore throat, and then you're wondering, is this COVID, or is this really from my mask? Right. And so, just you put it all together, and then working with the sickest of the sick is mentally, emotionally, physically exhausting. Right. You're also maybe the only person with a dying patient. It's not their families. And that is a huge emotional burden. And so some of the negatives and some of the impact of this whole thing goes many, many layers deep.
Absolutely.
So in the nursing facilities, back to those, because it's just an important subject, I think, and since we focus a lot on aging, let's do that now. The guidelines that were coming out from CMS, CDC, then there were state guidelines, then some cases there were county guidelines. They were changing every 5 to 10 days. Right. It was about the types of PPE you have, how to wear those PPE, about isolation, about quarantine, about setting up barriers to make makeshift isolation units, which at that time, last March, April, stores were selling out of the old construction plastic barrier walls.
Oh, yeah.
I
always call it a biz queen, but it's some kind of huge plastic that you paint with, or you could stick up on your wall, I guess, and try to create a barricade. I remember you doing it at one of the communities you worked at where, this whole thing covered the whole end of the hallway, didn't it?
It did. And they're duct taped up around the hallway because you had to isolate off your whole entire unit of COVID residents.
Unbelievable.
To keep them away from the non-COVIDs. And at one time in a facility I was working in, we had to do 2 units. We had to have 2 COVID units at the same time. And so when you had a COVID unit, you had to staff it with consistent staffing. Right. That staff could not enter or leave that unit into communal space. So you had to provide an exit to the outside. You had to have restrooms designated to them, eating areas designated to them. And I think it's not a secret that the biggest challenge in long-term care, post-acute care is staffing.
Mm-hmm. Oh, by far, yes.
Yeah, it's the number one problem. And so in these cases with isolating COVID, it was important to keep consistent staff behind those barrier walls. So the nurse and nurse aides that are working on those COVID units could not float to the other units. And so a facility that might have had 2 units with 2 units of staff that could cross over and help out on another unit really could not do that now. And so you had to have 3 sets of staff if you had 2 COVID units and a non-COVID unit. And that was challenging and difficult. And I can tell you that nursing homes did everything they could to secure staffing. There were huge amounts of dollars being paid to bring in extra staff, and that brought a whole other host of issues.
Oh, yeah. I think the government threw literally billions of dollars into this, didn't they?
They did, and that was through the Provider Relief Program. Yeah. And there were billions of dollars, and it had to be spent for absolutely COVID relief. Now, did 15,000 nursing facilities spend that for COVID relief? I don't know, but I'm going to say probably the majority of them did.
Now, Pam, your background is also being an infection preventionist.
Yes.
Did I pronounce that right?
Preventionist,
and
yes.
It's something new to me. What is that about, and how does that tie in with the COVID and your approach in these
So if you work in long-term care, nursing facilities, nursing homes, you are mandated to have what's called a certified infection preventionist nurse. And you go through a specific certification training that's the CDC. There's a couple other entities that have the training. You have to take 23 modules, and after you do so, you are declared an infection preventionist. So last summer, I decided that it was probably a good idea for me to be a certified infection preventionist.
I didn't know till recently that that's what you were.
Yeah.
And you're doing more than just washing hands and explaining that.
Yeah. So it's a huge program. Prior to the pandemic, all the nursing facilities had to ensure that they had very solvent and productive infection control programs that were effective and met all the mandated criteria. And on a side note, infection control has always been one of the top 3 regulatory citations for nursing homes. Yes. Okay. For years and years and years. It's always been one of the top 3 citations.
Now, why is that? Is it the staff, or is it the procedures, or what is it?
It's both, in that when I say they've been cited in infection control, it wasn't about nosocomial or in-house spreading of infections, which is what nosocomial means. It means an infection that occurred in-house. That they created. But those citations were a lot about observation, right?
Oh, watching the staff and whether
watching the nurse do a dressing change and put the scissors back in her pocket.
Okay.
Watching the staff enter a room to answer a call light, come back out, go into another room, and not wash their hands. Okay.
So one thing that's improved over the last year, I think more people are washing their hands, aren't they?
I think everybody is washing. My little grandchildren are washing their hands without being told. Yes.
Obsessive hand washers these days.
We are obsessive compulsive hand washers.
I think that's good because, between that and the mask, I know this year the flu season's got to be almost nothing, right, compared to previous
Oh, my gosh. So if there's any positive that came out of COVID, it's the wearing of the mask and the distancing, because the flu percentages have never been lower.
Isn't it something?
Yeah. Yeah. And if you just think of yourself, have you had a cold this year?
No, I've not. And usually I have some form of bronchitis usually in February, and I'm hacking away, and nothing this year at all. So.
No, it's because you are protecting yourself and from
and there's a degree of common sense too. I think I think there was reminders of telling people to do things like keep clean or stay away from people coughing and everything else.
Oh yeah. Anyway, so on a side note, back in the day when I was in nursing school, I was always taught that you can't beat hand washing. In fact, through standard precautions, which is your frontier line of infection control for healthcare workers. It's called standard precautions, used to be called universal precautions. And that is an expectation of infection control, meaning hand washing, number one, wash your hands. And when I was in college, I was told you must wash your hands all the time, which is nothing new. And up until not long ago, hand washing was the number one frontline defense against infection. Similarly with hand washing is the alcohol-based hand sanitizers, right?
I see that all over the place now.
So the CDC has since come out and said, actually, there's nothing better than using alcohol-based hand sanitizer in lieu of hand washing unless your hands are soiled, because the hand sanitizer kills germs immediately.
If they're a percentage, like 90%, or there's a high percentage.
There's a high percentage. And the more sanitizer you use on your hands, the more protected you are from germs adhering to your skin. So anyway, just a little side note there. In fact, I can remember not long ago, you weren't allowed to put alcohol-based hand sanitizers in hallways or resident rooms in the nursing homes.
Why is that?
Well, because the cognitively impaired could drink it. And so you had a risk.
Okay. Well,
And so it was they were always kept very high or out of reach. Now they're supposed to be everywhere.
Sure. And there's always cost involved when people say, do we really need that? I'm sure that involved somewhere along the line too. So
right.
Why do we need to do something in addition to what we already have?
Well, I'll tell you what, you can't walk in a nursing home today without seeing hand sanitizer about every 6 feet down the hallway.
Absolutely.
Yeah. So anyway, the facilities were trying to meet all the regulations. They were trying to adhere to guidelines. And then, of course, there were some bad, as they say, bad actors, right? There's always good and evil in everything. Right. So out of over 15,000 nursing homes, you got a few that just don't do the right thing. And then the news broke about several residents dying in a nursing home. It was a horrible story. And that they were being stacked in freezer trucks.
Oh my gosh,
and
I do remember hearing that.
Yeah, and families weren't notified.
As the morgue, yes.
And just a heart-wrenching, worst of the worst stories. And so CMS puts in higher and more stringent regulations because of that. I get that, and I believe that's needed. However, it is kind of like you're in, I don't know, Gary, you came from a big family with several children, and if one of the kids did something bad, were you all punished for it?
I don't recall that.
Okay. But you've heard of that, right?
Yeah.
If one kid is bad, everybody is punished.
Yeah, in this business it is, right.
Yeah, and so in nursing homes, that's exactly how it is. Yeah. You got one bad
apple, they call it.
You do. Then everyone is penalized for it. And so a lot of regulations and guidelines came out of that horribleness. And one of those was about reporting of COVID. And these nursing facilities had to report COVID numbers to their state agency, to the health department, to their counties, and to the CDC National Health Safety Network. And so think about the testing. They were doing sometimes 2 tests a week on residents, 2 tests a week on staff.
Right.
Getting those results, assimilating those results. Now they have to report those to 3 different entities, and a lot of times in 3 different formats.
Outside of the family.
Yeah.
Including
so that infection preventionist that we were talking about, his job is to ensure that all of that was in place. Their job is to ensure that that infection control program and all those guidelines are being met prior to the pandemic, but after the pandemic, all those new guidelines were to be met routinely and constantly, and that was that person's job. Mm-hmm. And so I started helping out facilities that were deep into COVID and helping them come to the other side of it.
Okay.
Going into facilities that were in a very bad place with, you have one positive, now we have three, oh my gosh, now we have 4 positive, we have 2 staff sick. That's how it begins. It's fast and furious. And you have to act today. You have to act right now today to eradicate that spread.
Yeah. What did you do? I mean,
what
would you recommend, I guess,
right.
if people are still in that spot?
You work nonstop until you isolate, right?
You isolate.
You isolate. And so people have to immediately get moved and transferred to a designated isolated area. You have to have up those construction walls. You have to have staff available today, right now. You have to make provisions that you never cross equipment through those barriers. And if you do, it has to be completely sanitized each and every time before it comes back out. You have to ensure that you have PPE on that unit that's adequate to meet the needs longer than a couple days, because you can't keep taking in and out of those units.
Right. So the isolation, wouldn't you agree, that's got to be one of the number one things families have concerns about in the last year, right?
I think
the isolation. So. And at the same time, it's what saved them. What saved whoever's there that didn't get it was they had to be isolated.
That's a very true statement. So the mandate and the eradication of COVID in a nursing home was about isolation. Mm-hmm. But that also involved a social isolation from their families, which was probably the worst thing that came out of it. It may have saved many, many lives, but it certainly caused many declines in condition.
Absolutely, yeah. I was thinking one of the company I was with at the time had a good discussion about the difference between physical distancing and social distancing, and how in our society here we talked about social distancing as being that 6 feet. But it was really physical distancing, wasn't it?
Yeah.
That's really what we wanted. We didn't want to isolate people, I think, in any part of this thing, whether it's your family or people in senior living or nursing homes. But it turned into really more of that isolation. I think that's something, looking back and looking forward, is to say, what could we have done differently to avoid the social aspects of isolation?
Absolutely. I saw many, many, many patients, elderly, decline quickly, not because they had COVID, but from the effects of isolation of COVID.
Yeah, I was going to ask you about that. I was talking with a former worker the other day, and she was saying about her grandmother that had gotten COVID. She was starting to have dementia, and then got COVID and went in the hospital, came out and progressed so quickly in that disease. Is that something that you've seen, or
yes,
it makes sense that might have happened to?
Absolutely. The industry saw a huge cognitive decline in their residents, and a lot of physical decline as well. Even if they had mild cases of COVID and they recovered, just the isolation, just not having contact, created horrible effects.
Oh my gosh. And then the other thing I read about was about falls, and how people they weren't exercising. People aren't, even people in their own homes not getting out and doing a little walk around the grocery store. In fact, those
Sure.
types of things. They've limited their mobility.
Every 1 day of no activity creates 3 days to recover.
Wait, it sounds like me on weekends. So
Right,
every
right.
day of inactivity requires 3 days of activity?
It does. You have to work
I'll never
yourself
catch
back
up.
up.
Yeah,
Right.
I'll never catch up for those Saturdays and Sundays. I'm laying on the couch, I guess.
And when you're 85 years old, you can go 1 day of no movement or no contact with another human, and it takes a little bit of time.
Oh my gosh.
To get your thoughts right again.
I didn't know that.
And to function as you did prior.
Mm.
And so you can see how this created just a widespread decline. Mm. And what was really bad was the impact it had on the families on the outside of the nursing facilities, right?
Well, I got to talk to many of those.
Or you did. Gary, in fact, you went through a period where that's all you did.
Yeah, that was fun. But and again, it's interesting because it really, if you really boil it down to, it was the isolation, the concern of technology can never replace being in person. You know what I mean?
How did you put their mind at ease?
Well, I don't know if I did. I think I just basically, reinforced that. I think part of it is to just say that the staff really is their family. They're not by them. They're not in like a cage or a box or something all by themselves. The staff is in there constantly, and our staff cares about them and knows them more than you probably know them,
yep.
and interacts with them. And also just the context, whether it's calling out to the families or sending them information, constantly saying, everything's okay.
Yep.
And so, I think that reassuring families that open lines of communication are always the best things that might happen. If you had some suggestions going forward, I'm thinking about, design things in the future for senior living. Does it make sense to have more private rooms,
yes.
Versus a shared room?
Yes.
That's traditionally been in that business.
Absolutely. So there was a time years ago where all these nursing homes were being built, and it was about the more beds, the better. And then there were multi-level facilities. And we realized even prior to the pandemic that the baby boomers, they want their privacy. They want their space a lot more than 25, 30 years ago. And so now with the pandemic, it is going to make sense to have more private rooms, more areas to isolate, different types of dining structures, because we realized we had to shut down communal dining for months and months and months. And to this day, there are still many, many, many nursing homes that are not having communal dining today. Same with assisted livings. Even though many of those are starting to come back, there's still many that aren't allowing visitation, and they still have their restrictions. And so structurally, there are going to have to be changes. Infection control protocol is going to have to get more stringent and more secure than it even used to be.
Okay, well, this is all heavy-duty stuff, Pam. I tend to be one of those that's the eternal optimist, and so
you are.
I often say when I think about life as the windshield on my car. It's quite big, the windshield, and the rear view mirror is pretty darn small, and it's in the past. So I'm trying to drive forward through this thing. And I was thinking about some of the things maybe we've learned, and some things that we can carry on and share with our audience. A little bit of upbeat type of things. I always say, maybe I've said it already, that, natural disasters was a great equalizer. And when you stop and think about it, it didn't matter if you had $1 million, you may still end up on a ventilator, and you may not get to go to a movie theater or to a restaurant.
Correct.
And so in some ways, we are all in this together. And I think in some ways, when it came to the things we value, I think there are people that step up in crisis, a lot of healthcare workers, but I often think about the people in the grocery stores.
Oh my gosh. So think about these poor workers at Costco, Walmart, the grocery stores, on and on, the essential workers. They were doing this without any protection whatsoever.
Well, most of them had a mask on, but yeah, as far as, but they had public people. I remember going in and half the people had a mask on, half didn't.
Correct.
And it was like more of a statement than anything. But
sure.
So I think appreciation for, at the end of the day, I think everyone's in some ways a first responder, whether they're healthcare workers or grocery clerks, but even people like bank people and the bus drivers, anybody that kind of dealt with the public seemed to be in that spot.
What about the Amazon deliveries?
Oh, yeah.
Think about that.
Well, I know in our family, I swear it was like Christmas every day. We got a present every day.
No, right?
And,
that's all you did. You saw boxes sitting on people's porches and,
oh, yeah.
and everywhere.
And I would go out there from time to time and greet these, the delivery guys, thinking you're a first responder, as they deliver my cat food,
right.
and pajamas and different things. I'm going, this guy risked his life so we could get
Absolutely.
this.
Yes.
And it felt that way, didn't it, for a while?
It did.
Oh, my gosh. And then you stop and think about technology. And, I think things like telemedicine we talked about 2 years ago. Oh, that'd be a nice thing to have happen.
Never really did it
in
that
I think
industry.
It's here. I think that's here now. I think physicians are now saying you don't have to come in, just either jump on Skype or one of those type of things.
Do you know that CMS was not a huge supporter of telehealth and telemedicine in the nursing homes in every state? And then when COVID came around, there were a lot of waivers and a lot of leniency. And I'll tell you, it's like a great thing to have that.
Yeah. And, when thinking about telemedicine, I was thinking about, 2 years ago, comorbidity didn't mean much. I probably have 2 or 3 things that are probably going on that would fit me in some category like that. Now it does matter. All of a sudden I'm thinking, gosh, being healthy might matter here. Right? And so, when you stop,
finally realized, is that the good thing?
Well, I've always realized it, but the idea that, if you don't have your health, I hate to say, you really don't have much. You could have a millions and millions of dollars, but if you are, near the end on a ventilator, that money's not going to help you. And we lost many, everyone that was lost was a tragedy, but there's many people with national and world talents that we've lost because of this.
Yep.
And as we said, I think there's certain things that we're going to have to deal with in the future as far as, it's almost like, was it post-traumatic type of things. The staff I worked with in these senior living communities, I don't know how they dealt with death like that. They would deal with people dying every day, sometimes more than day. And they fought through it. I'm going, that's going to, sooner or later, that's going to catch up to them. I mean, that's one of my concerns is the whole mental health, not only the healthcare workers, but think of people that have self-isolated for a year.
My brothers.
Yeah,
Your brother.
I've got some relatives too that, on their own decided it would be best to isolate themselves.
I have not seen my 2 brothers in a year.
Yeah, and so I think that's a very difficult type of thing, and I know there's a difference between being alone and loneliness, if that makes sense, but it's still the idea that happened. And I was even thinking the other day about volunteers. How many people volunteer, not just in the senior living, nursing homes and those things, but in different settings. Mm-hmm. And in the last year, they've not been able to. They've not had that connection they needed to doing what they're doing. Mm-hmm. There's stress involved in all these different things. And, I guess I'm trying to be optimistic and positive that I'm not sure when this ends, whether it's going to end with like a specific date that says this date it's over or if it's going to slowly fizzle out. I was sharing with you, Pam, that I went to a lecture one time years ago. Really smart guy. But it was boring as all get out.
Right, and as most are.
As slowly throughout the presentation, people started to get up and leave. And I'm thinking that's kind of how the end of COVID in my mind is going to be. People are just going to leave it. You know what I mean? There's not going to be a big flag day and a parade down New York City. I think it's just, we haven't talked about it for a while. Yeah.
I can absolutely see that happening.
Can you? Okay.
I can, because even now where we are, restrictions are lifting, right? We still wear our mask. We still are careful. But there are restrictions lifting. We don't have a curfew anymore at night. We can pretty much go wherever we want to go. But it's almost like you'll ease your way back into life.
Right. That's right. I think what we need to look forward to. I had written down a question because I was thinking about this the other day. And in my garage, for some reason, for Christmas or a holiday or birthday, a relative gave me this red backpack. And it's still there. It's the survival packet. If the end of the world comes, we've thrown it in the car a couple of times when we're traveling for some ridiculous reason. But
are you a doomsdayer?
No, not by all means. But it's good to have like 3 days.
But you might be
3 days of terrible food and some water in there. And I was thinking about what would you put in, Pam? With your background, what survival things would you put in if we ever kind of were trying to plan ahead for the future?
Hand sanitizer.
Just gallons of it?
Gallons of hand sanitizer. And maybe
a couple candy bars or something?
No, a couple cans of disinfectant to do cleaning. Okay. Because that was my biggest issue in the beginning.
Oh my gosh. What comes to my mind is probably those word search books or Sudoku books. I'm going to be isolated,
right.
And a good pencil, something that I can resharpen because.
You're right. Gary, think about all the people that were ordering games. They never played games. They never did puzzles before in their life. I know so many, even people in my own family, my children, they were putting together those several thousand-piece puzzles.
Oh, yeah. We did our share of puzzles, or tried to do that. Well, this has been a fun time again talking with you. It's a heavy subject, and hopefully, down the road we can look back on this as our listeners do and kind of say, I'm glad we don't have to talk about that anymore. I'm glad that's in the past, but hopefully we've learned lessons.
Yep.
And it's all an adventure, right? Adventures in aging, and we appreciate people listening to our podcast. If you like it, please share it. Please subscribe to it. Please review it, and And please join us again when
Yes.
we take you on another adventure.
Yeah. Thanks, everyone. Bye-bye.